out of 10, 5 will be overweight or literally obese. And that is the main problem in India right now. I always feel that even I'm in America for last 55 years. The America is my working mother. I'm born in India and I owe India, my country, something.
નવી સવાર યુટ્યુબ ચેનલમાં હું અનિતા તન્ના આપ સૌનું સ્વાગત કરું છું. આજે નવી સવારના સ્ટુડિયોમાં આપણી સાથે ઉપસ્થિત છે ડૉક્ટર મીતા પિયર. ડૉક્ટર મીતા પિયર મૂળ પૂનાના છે. પૂનામાં જન્મી અને ઉછરેલા છે. એમના પિતા ડૉક્ટર ભાણગે એ ખૂબ મોટા સેવાભાવી ડૉક્ટર હતા. પિતાના પગલે ચાલીને મીતાબેન પણ ડૉક્ટર બન્યા અને પૂનાની સાસુન હોસ્પિટલમાં તેમણે નોકરી કરી. નોકરીના ભાગરૂપે જ દર્દીઓની સેવા પણ કરતા હતા. આવી જ રીતે એક પ્રસંગ બન્યો અને મૂળ કચ્છના દેવેન્દ્ર પીર સાથે એમનો પરિચય થયો અને એ પછી એ બંનેનું લગ્ન થયું. લગ્ન કરીને આ દંપતી અમેરિકા ગયું. અમેરિકા ગયા પછી પણ મીતાબેન ખૂબ સરસ આગળ ભણ્યા. મેડિકલ ફિલ્ડમાં જ એમણે વધારે ભણી અને અનેક ડિગ્રીઓ લઈને ત્યાં એમણે ફરી પોતાની ડૉક્ટર તરીકેની ફરજ બજાવી. એવા મીતાબેન આજે આપણી સાથે ઉપસ્થિત છે. હું મીતાબેનનું હાર્દિક સ્વાગત કરું છું. નમસ્તે. નમસ્કાર. મીતાબેને ડૉક્ટરની સાથે સાથે આપણે એવું કહીએ છીએ કે ડૉક્ટર એટલે અડધો ઈશ્વર. એ રીતે જ એમણે દર્દી નારાયણ ગણીને એમની સેવા પણ કરી છે. પોતાના પિતાની સ્મૃતિમાં ઘણા વર્ષોથી એ પૂનામાં આવેલી લતા મંગેશકર હોસ્પિટલમાં પણ આરોગ્યનું કેમ્પ ચલાવે છે. પિતાની સ્મૃતિમાં એમણે ડૉક્ટર ભાણગે પુનર્વસન કેન્દ્રની પણ સ્થાપના કરી છે. ડૉક્ટર મીતાબેનના પતિ એટલે કે દેવેન્દ્રભાઈ આપણા ગુજરાતના પ્રસિદ્ધ અને જાણીતા લેખક ફાધર વાલેસના માનસપુત્ર હતા અને ફાધર વાલેસને પણ એમની સાથે ખૂબ જ આત્મીયતા હતી. એવા ફાધર વાલેસ, મીતાબેન અને દેવેન્દ્રભાઈ આ આખી એક સરસ ત્રિપુટી છે. આજે મીતાબેન આપણી સાથે ઉપસ્થિત છે. આજે આપણે એમના આરોગ્યના અનુભવ વિશે વાત કરવાની છે. नमस्कार.
नमस्कार.
जे आरोग्याचे अनुभव अमेरिकाचे कसे आहे ते आमच्या दर्शक मित्रांना तुम्ही
First thing, I'm truly appreciate having me here and my deep apology that I'm not able to speak fluent Gujarati, so I'm going to speak in English, but Anita Ben will able to translate
Yes.
and let you know the
Okay.
message from me.
Okay.
Thank you. The question is, what is health?
What is health?
Yes, this is a big question, health. As we say, health is wealth. So, to preserve your health, you need a lot of things in life, like a discipline and about your diet, exercise. There are a lot of factors which are very important to keep your mental as well as physical health.
In America, what's your experience become a doctor?
When I entered in America, it was way 55 years ago, 1973. And that time there were very few foreigners working in America. But when I started working in the hospital there, first thing what I really felt that there was no discrimination that I am a foreign doctor. They really accepted me as a physician, okay? And people are very aware of their health. And they do take care of that because awareness, their education, as well as the ability or what I should say that they can go to any hospital because they have insurance. So they know that they don't have to pay from their pocket, and if they have mental or physical problem, they immediately approach to the healthcare system. So that way they are approachable to the health system. So they do take good care of themselves. Unfortunately, in developing countries or our countries, the main issue is that people, whether they are sick or even normal, has to pay from their pocket, and they that time think 3 times before they can approach to the health system. And usually they do go to the physician when the things are out of control, which should not be. We do not have a awareness of prevention of the diseases or prevention of illness, but just approach to the healthcare system when they are really sick and they need a medical advice or medical treatment.
What is your specialization subject?
I did an MD in pediatrics in Pune. Then I went to America with my husband, and I was thinking that time that I want to do something specialized in pediatrics. Because when I was doing pediatrics, that is child health, there are a lot of children which parents used to carry on their laps or on their back because there was no wheelchair, there was no walker, there was no cane, no adaptive devices were available, no rehabilitation was available. So I decided to do the fellowship in pediatrics rehab, and that's what I did in Brooklyn, New York for more than 2 years.
You work with Pune in Lata Mangeshkar Hospital also.
Right.
What different between America's health working system and India's working system?
As I said that, that America, people whether are sick or they have any question about their health, they approach to the medical system. But in India, as I said, people don't feel like going to the doctor unless they have unbearable illness. That is the difference. In America, even average person is aware of what are the things to do to prevent the illness or prevent any medical problems. That awareness is improving in India this time when I saw that. But still we need to educate the general population about how to take care of the health before they get sick.
How to educate people?
Okay, I think there are multiple ways we can educate. Number one is their own community. There should be some seminar for prevention of diseases or how to approach the medical health system before they can get sick. The newspaper, the social media, and now the modern thing is WhatsApp. There are a lot of other new technologies available where you can teach the general population about the health care.
What about our children's health?
In India, children, I think the malnutrition is still there. Then there is always a lot of physical abnormalities in the children like cerebral palsy, paralysis due to meningitis and all, like congenital deformities. All those things are much less now than what I saw 25 years ago. So there is some awareness that the woman is taking good care of during their pregnancy and avoiding any genetical deformities or any kind of malnutrition with them which can cause the deformity to the child.
Women health issues.
I think I can see a woman still have some now malnutrition, but which malnutrition is excessive weight, obesity. This is the problem. 30 years ago, the woman have a problem because of the malnutrition during pregnancy, lack of proper diet and everything. Now, the problem is just the opposite. I can see every 10 people, if I see the walking on the street, out of 10, 5 will be overweight or literally obese. And that is the main problem in India right now, obesity. In America, obesity is called as a disease now. It is considered as a disease, and they are taking really, really good approaches to reduce the obesity. But I think in India, we still lack in awareness of the women that obesity can cause multiple medical problems in the future. And that is what we had to educate them about the health.
How we educate women?
I think woman is in charge of the kitchen really. So she should know herself, what are the things, because whatever she is cooking, she has a problem herself, but the entire family can be affected by that. So she has to be educated herself by, community, from her medical doctor, or even the friend circle, media, and mainly the communication, that how the obesity can result into the high blood pressure, diabetes, joint diseases like knee pain, back pain, all those things are result of the obesity. And I'm here for last 3 months, and I don't think even the educated woman is aware of that overweight is a big medical issues in the future.
Today, India is hub of diabetes.
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 Yes, right. Yeah, I think India is number 2 in the world where the incidence of diabetes is very high. And that is mainly not the diabetes type 1, but diabetes type 2. In modern medicine, there are a lot of new medications are in the market. And I think what I saw, awareness of controlling diabetes, it has been improved a lot in last 3 years, which I'm about the diet, what medication to take, what are the exercises should do, and how to avoid diabetic complications such as amputation and all the stroke, high blood pressure, or heart attack. These are the complications of diabetes. But I think the awareness has definitely increased about diabetes and its complication in India. When I was observing in India, when I go in the clinic, my clinic, I can see that people are more awareness that how to control their diabetes, which is a good news for me.
Still you are working with your clinic in India?
I mean, I always feel that even I'm in America for last 55 years, the America is my working mother, but I'm born in India and I owe India, my country, something. So I always wanted to do for my people. So in 2003, with Lata Mangeshkar's help, I was able to build the one rehab medicine department in Pune, where I worked in 2006 till today's date. Right now, I'm working as a director and the consultant in rehab medicine, especially the stroke area. And I'm trying to give something from me to the community to help them to give the quality life.
What you say, people, how to prevent your health or how to happy your life?
The happiness, as I always say, that is in you, okay? How you feel happy. I think, as I said in the beginning, if you keep your mental health and physical health in such a way that is really will not cause you any damage to your mind or the health, and you should really give a priority to your health. And if your health is good, you mentally are more alert and mentally you are happy. So the health, as I said, health is wealth. So if you want to become a healthy, you have to be wealthy in your thinking.
Thank you very much.
It's my pleasure, and I hope my message can give some message to the community about their health. Thank you so much.
નમસ્તે મિત્રો, આપણે સાંભળ્યું કે મીતાબેને વારંવાર કહ્યું કે આરોગ્ય એ જ આપણી સૌથી મોટી મૂડી છે. એટલે ગુજરાતીમાં કહેવત છે કે પહેલું સુખ તે જાતે ન રહ્યા. મને લાગે છે કે ડૉક્ટર મીતાબેનની વાત અને એમનો જે સંદેશો છે એ આપ સૌ અને આપણે સૌ જીવનમાં ઉતારવાનો પ્રયત્ન કરીશું અને આપણે બધા જ શારીરિક અને માનસિક અને ભાવનાત્મક રીતે તંદુરસ્ત રહીએ, ખુશ રહીએ એવી શુભેચ્છા સાથે નમસ્તે.